So working on bending your knee. So again, you need a rope. So again, we need neutral spine. So we need to find that seat bone position. So move your pelvis forwards and back. So slumping back, vertical, rounding forward, slumping. So I go on my tailbone, where I go have a poo from, come up to the middle, I go all the way over to the front bottom, to the pubic bone. Right, where the middle of my bottom is down there, I feel the seat bones hardest into the ground. If I take my hands under my bum, I can feel the seat bones pushing into my fingers. If I go back on the tailbone, the seat bones roll forward. I come up, they go into my fingers, I go around, they go behind. So where those seat bones go into my fingers is where I have to sit. That's where the pelvis has to be when I stand, when I sit. And when I lie down, it needs to be horizontal. So using the skipping rope or the rope, I'm going to do it on my right leg only. So I'm going to put my left foot flat on the floor, keep that knee still. So I put that rope where I feel comfortable and I lift myself up. I'm now going to slump back, pull that foot in a bit closer, sit up onto those seat bones and I'll roll forward and it'll bend that knee a bit more. I can either try to drag my foot back, but what I don't want is for this to be slumping back. I need to stay up as I pull that foot back. So I can rest that, if I want to rest the toes on the floor, and I can put my toes against something. I can use the rope, but it's a bit harder because you're pushing into it. If I have a step against something like that, and I have my foot up against it there, and then I use my hands and I slide my bum in, hold on to the front of that leg, lift myself up, lean myself back, slide my bum in, lift myself up, and I'll get that knee closer and closer. I'll get that knee more and more bent. But you need to have the pelvis vertical, the neutral spine while you pull in. You don't want to be doing this and twisting with your body as you're doing it, because then you're giving at the top here. You've got to keep that square. And that's important for when you start to do step up, step down on boxes or on steps. So you can release that. You can also do some knee bending with yourself lying. So lying on our back on the floor, roll those shoulders up to the ears, slide them down, keep those palms up, keep the upper arms in the floor, keep the shoulder blades flat on the ground. Arching that lower back, so my tailbone goes down and my pelvis tilts. So I've got the front of my pelvis here and I've got my pubic bone here. So if I flatten my back in the floor, the front of the pelvis goes down, the pubic bone lifts. If I arch my back, the pubic bone goes down, this edge lifts. Flatten, this is called pelvic tilts, tilting down. So the back is going, the top is going behind, and then the bottom goes behind. So that's a posterior tilt and an anterior tilt, because the top comes in front, anterior. Top goes back, posterior. Arching and lowering. Now find that middle position where the pubic bone and the bony bit here are horizontal to the floor. There should be a small lift on your waistband. Roll those shoulders up to the ears into the floor, pull them down. So we're in neutral here. Now I can do all those same exercises with my, that I've done sitting, I can do lying. So using the rope, I can put the rope around my leg and I can have that foot on the floor. So it can be however far away it is. Keeping in neutral, I can pull that foot up. I can pull that foot up. So I'm bending my knee, being careful not to let it drop out or drop in. I pull that foot up. So here I maybe feel that my hip is hitching. So I push that hip round, make sure I stay neutral, make sure the core is strong, the glutes are strong. Breathing in on the out breath, relax those shoulders, pull that foot in a bit, push that hip bone so it's square, so that I'm bending my knee. Make sure the knee's not dropped out to the side or rolled in. Look at it, is it above the hip? Is it central? Okay, so that's bending your knee while you're lying. You can also pull that knee up above you here, and you can pull that knee down, giving it bend there. The other way to bend the knee is on all fours. So again, I'm on all fours. I've got my neutral spine. So I tilt the tailbone down, so my pelvis goes down at the bottom, and then I tilt my tailbone up and my belly comes down to the floor. Neutral position is just a bit away from that, where my pubic bone and the front edge of my pelvis is parallel to the floor here. So in that position, I can just glide my body backwards and come back up. Glide my body backwards and come back up. Glide my body backwards and come back up. Now, if you've got a foam roller, you can put the foam roller, or you bring it into your knee so that you glide the body back and you rest against that. And you can gradually let the roller slide away so that you're pushing until it comes to the heel, pushing. And then you can move that roller onto the heels. Onto the heels here, so that you increase the bend in that knee until eventually you get rid of the roller and you're down, you can get yourself right back. Stretching the muscles around your legs is really important for your knees. So you've got your hamstrings, your glutes, your quads. The quads are the most important ones. They hold the kneecap tight on the knee joint, and they create a bit of stability in standing with your legs straight. They create a bit of stability to stop the knee wobbling around, but they are not the crucial stabilizer. Your glutes are. So your clam exercise, which is the one lying on your side, fires up your glutes, and the one lying on your tummy. So to start with, we're going to do some hip stretching. So we'll do it in sitting to start with, then we can do it in lying and in lying. So sitting up tall, hold that. So again, get onto the front bottom, roll those shoulders up to the ears, down and back, push that right knee down, push that left knee, push that right knee, push that left knee. Taking hold of that rope around those feet, holding onto the rope, sitting up tall. Pull your body forwards, flexing those hamstrings, breathing in. Breathing out, pull that body forwards, push those knees down towards the floor. Breathing in, pull that body forwards, pushing those knees down to the floor. Sit up nice and tall. Pull that body forwards. Sit up nice and tall. Pull that body forwards. Release that rope. Take the left hand to the right knee. Pull yourself down. Doesn't matter even if you're here. Pulling yourself down and forward. You should feel the stretch down the outside of that leg. Right hand on the left knee. Pull yourself down. Push with that hand and turn so you feel the stretch on the outside of that leg. Sit yourself up nice and tall. Cross that left leg over. Pull the foot to the bum, let the knee flop. Take hold of the knee, pull it up, lifting that chest up. You should feel the stretch through the glute. Push that left glute in the floor. Feel that stretch. Breathing in, turning left if you want. And then release. Other leg, cross the leg over. Pull the foot up. Bring that knee up, turning to the right. Pushing that bum into the floor. Breathing in, breathing out, and release. Try this one, turning the foot out, turning the leg out. So if I angle myself a bit more, I've got my left leg straight, right leg like this. Turn my body towards that leg, lean back, and I'll feel the stretch through here and through the back. Stretching. If I can come down onto my elbows, that's great. That might be too painful on your knee. So the best stretch for your quads is kneeling. Use a towel, so you put your knee or your shin bone on the towel, so you're not actually kneeling on the knee joint. Put the other foot up in front. Pull the crutch forward. So you clench with the bum, drive forward here. Tummy button above the crutch, breastbone above there. So your tummy muscles are contracted. Roll the shoulders up to the ears, down and back. I'm supporting my body on the left-hand side with my leg, and I can hold on to something if I want. Bring this left hand up into the sky, breathing in. On the out breath, imagine I'm pulling this knee forward, so tense the front of this leg. Breathing in, breathing out. Breathing in. On the out breath, push that right arm up in the sky. Push the right knee down in the floor. Push the hips out to the left, out to the right. Reaching and stretching. Breathing in. Glide the body forwards towards that front heel. And then release. And I would do both sides. So change side with that towel. Rest the shin bone on it. Put the front foot up. Draw that pubic bone forward. Draw that tummy in. Lift that upper body up. Clench the bum and push push the glutes, pushing into these hip flexors. Roll those shoulders up to the ears, down and back. Bring that left arm up into the sky. Breathe in. On the out breath, push that left hand up into the sky. Reaching, stretching. Breathing in. Breathing out. Reaching and stretching. Lifting and release.